doing hundreds of screening colonoscopies every year. Having done thousands of them, I can literally count on one hand the number of patients that I've had who've had an interval cancer, meaning somebody diagnosed with colon cancer, within 3 years of a colonoscopy that I did. Maybe that means I'm a good colonoscopist, but remember, I'm also using standard equipment, not using this. So now you're asking me, okay, well, you should use this product, improve your ADR, reduce your colon interval cancer risk, but I'm not necessarily. It's not something that I identify as a problem in my practice or an unmet need, really, at the present time. I think that's how I would summarize it. Now, all that being said, I think the product. Oh, I'm sorry. One other point, and maybe this is covered in the slides for some reason. See how you can play this, but it's not playing. Maybe I'll try a different browser. But maybe does the slide deck from that R&D day divide the polyps by size?
Let me just bring it. I'm just in a different room, not on my normal computer, so 1 second.
Well, actually, maybe I'm sorry. You know what? I might be able to pull it up in PDF form. Yeah, I think I do it as like. I actually have it in. So one question, what I'm getting at is, so adenoma detection rate is definitely a very strong and powerful outcome that I'll track that. I perform procedures, card, if you will, and that's the major.
Is that so? I saw something on the CDC or CMS that was potentially going to be used as a hard outcome for colonoscopists. Is that something that's occurred, or is that not?
That hasn't happened yet. It's more of sort of that's not happened yet, but it certainly could be because there's very good data to suggest that ADR is a good way of judging quality of colonoscopy. And my practice, which I would say is probably standard, standard these days, is that track it in or card. That the results don't go anywhere else at the present time, but it is being tracked. So we are concerned about our ADR for sure. But when it gets into, that's just a quality outcome that that we're may affect ultimately reimbursement or whatever. But in terms of being clinically relevant, improvement in adenoma detection rate, you want to ask the question of whether or not adenomas, what are the size of the adenomas that because the problem with chromoendoscopy from prior studies is that it tends to increase the ability to pick up very small polyps. And
very small.
Yeah, and those are not really as clinically relevant. Is there something that you should think about when you're evaluating this product? Now, if you find it's actually a problem because we're so focused on ADR now that we're being basically told like we should out of the colon that we see that's one size. If it's an adenoma, that'll increase our ADR, but clinically, that 1 millimeter adenoma is probably relevant because the risk of transformation into a colon cancer from that tiny adenoma is very low. It's the larger ones that are a higher risk. So, it's something to think about in terms of this particular product, and I don't know that but certainly there's data to suggest that ADR correlates with colon cancer.